MIHIRA, we've seen an uptick in catheter-associated urinary tract infections, UTIs, on the unit. We need to be more vigilant. It's crucial to maintain strict aseptic technique during insertion and care.
Absolutely, Leah. I've been emphasizing hand hygiene and sterile field preparation to the team. We've also implemented hourly rounding to assess catheter security and patient comfort.
That's great. But we also need to consider catheter dwell time. The longer a catheter is in place, the higher the risk of infection. Let's review the order sets to ensure catheters are removed as soon as possible. Also check the types of catheters we're using. MIHIRA, some materials are more prone to biofilm formation.
Good point. I'll look into it. We should also provide more education to patients and families about catheter care and the importance of reporting any signs of infection promptly.
Mihira, I understand that you're experiencing discomfort, and I want to walk you through what might be happening in a way that feels clear and reassuring. The pain you're feeling could be related to irritation or compression of the sciatic nerve, which is the longest nerve in the body. It runs from the lower back down through the hips and legs, and when it's affected, whether by inflammation, pressure from a herniated disc, or even muscular tension, it can cause pain, tingling, or weakness that radiates down the leg. This condition is commonly referred to as sciatica. Most cases improve gradually with rest, gentle movement, and supportive care. However, it's important to keep an eye on how things progress. If your symptoms don't improve within a few weeks, or if you begin to experience more serious signs, such as difficulty controlling your bladder or bowel, significant weakness in your leg, or numbness in the area around your inner thighs and buttocks, often called the saddle area, then it's essential to see your GP promptly. These symptoms could indicate a more serious nerve involvement that needs immediate attention. You're not alone in this, and with the right care, most people recover well. If you'd like, I can help you prepare questions for your doctor or suggest gentle exercises that might support your healing.